When thinking about the medical field, people only really think about shows like Grey's Anatomy, where everything is over dramatized. Nobody really gets to see the real aspects of hospital life and how things work in the hospital. Through a program called TAP MD through Cincinnati MD Jobs, it's a medical program. It's what I'm going to tell you about today. The reality of a hospital is seen. Beginning with a personalized lab coat and ending with an award of recognition of achievement, those aren't the only two aspects that were really awesome about the program. The best part about the program was all the middle matter and all the sessions that happened. So, the first element of the program I'm going to talk about was the lab coat and the different hospitals that I went to. As you can see, right behind me is my lab coat, embroidered with my name and TAPMD on it. It's personalized, and we get them at the very beginning. We toured and explored 12 different hospitals, which concluded 12 different units. Every hospital had a different unit that we explored. The way the program works is that there's one session every month, and every session is a different unit. It's its own department in the hospital. The lab coat is significant to this because we were required to wear the lab coats at every session that we did. So every time we went to the hospital, we wore our lab coats. And basically, we were like residency students getting ready to finish up their med degrees in med school. So that was really cool. Um, the sessions were incredible, and they included a wide variety of things that we got to look at, which brings me to my next point. The bulk of the program was being the sessions. We did a lot of different things. I picked 5 specifically that I want to talk about. I'm going to talk about the 2 live surgeries that we did, ultrasound technology, cardiology, children's simulation center that we went to, and UC Health trauma and ER room. So first of all, talking about the live surgeries, the first live surgery that we saw was a nephrectomy, which is the removal of a kidney. The second one being a heart surgery, putting a new stent in a valve in the heart. One thing that was really cool that I like to talk about the program and the reality part of the program versus, the Grey's Anatomy, the drama filled, was during the heart surgery, there actually was complications, so we were unable to continue watching, which on TV, they dramatize that really big, but they still let you watch, which in general, when there's complications, that kind of goes to a private realm. So, and then for ultrasound technology, actually, the reason I like that one the most is because it was done at the local hospital here that's like 15 minutes away from my house. So there were a lot of nurses and people in the ultrasound rooms that I got to see that I knew. Also, there was the big part about the ultrasound part and being part of TAPMD is that we got to look at actual patient files that had been approved by patients for us to look at. So we got to see babies, we got to see a lot of bone scans, MRIs, everything. Cardiology was really cool because I actually have an issue with my heart, so it was really cool to look at that and talk to the main cardiologist at the hospital. The simulation center was really cool. We got to do a lot of hands-on activity there where they practice simulating like maybe a situation in the ER room or having to draw blood, anything like that. That was really cool, and you got to practice on dummies, real life dummies, simulation dummies. And then the last thing I was going to talk about was the trauma center at UC and the emergency room, which was really cool because we actually got to go into rooms with patients who were stabilized and talk to them about why they were there, how their treatment had been, what kind of things they'd been going through, why they were being treated the way they were treated. And it was really cool to see all the different sides of medicine to help aid people in getting better, which was a big point of this program. Lastly, I wanted to talk about the award that we got at the end. The award of recognition was really satisfying to have, but it definitely was not the best part to get out of this experience. Like I said, the bulk of the best part of this experience was all the sessions that we got to go to at the hospitals. I feel like just exploring through all the fields, I was able to make an impact on the lives of the physicians and patients who were already there, who we were visibly seeing every time we got to go. And I felt like it was good to know that they have people who care so much to be coming to follow them up. Like the physicians have people who are following them to be good physicians and following their set example, whereas the patients know in the future that they're going to have physicians that are going to know how to take care of them. So I felt like that was a really good impact to make. Also, I felt really connected to finding my field of medicine that I wanted to explore. I knew through my education and my book work at school that I wanted to go into the medical field, but I really didn't know until the hands-on part of this program, which helped me settle on brain surgery. And now I'm going to continue my education in a pre-med track. All of the courses that I've taken have been really science related and have geared me to being in the medical field, but like I said, the program really sealed the deal for me. Thus, having a personalized lab coat, such diverse sessions, and an award at the end of all wrapped into the program, it was such a treat. This here is the award given at the end. It's a certification of achievement, and it's got your name on it, and it's through Cincinnati MD Jobs. It was an amazing chance to expand my knowledge through a hands-on type of learning and rather than textbook education.